And in our studio is Dr. Joe Congeni, Sports Medicine Center at Akron Children's Hospital. Joe, the story came down Sunday afternoon in the Chicago Bears football game. There was a knee injury, and the tight end goes down. Then all of a sudden I was reading, battling to keep his leg. And my wife looks at me, she said, how does that happen? I said, not sure. You can tell us.
Yeah.
What happened here?
Yeah, Ray, this is that rare injury, but it can occur in the NFL. It can occur at a high school or college field near you. So that's why this is newsworthy. This is that knee dislocation, not a kneecap dislocation. Patellar dislocations happen all the time where the kneecap slips out partway and things. This is where the whole knee dislocates. For the knee to dislocate, usually there's at least 3 ligaments torn, the ACL, the MCL, sometimes the posterior cruciate ligament tears too, but 3 of the 4 ligaments, and the knee actually shifts out of its normal position, a total dislocation of the knee. When that happens, 2 structures that are not infrequently damaged are going to be the nerves and even the blood vessels. And that's why it's a big deal. And that's why the medical team, the trainers, the doctors, really trying to pay attention really closely. You've got to see this thing. And if you see the whole knee dislocate, another one of those gruesome injuries that unfortunately we've had the last few weeks. But when you see that knee dislocate, you have to send that kid by a squad, very important, to an emergency room and a facility with what we call vascular people, surgeons that are able to repair that. So in this case, it happened to be the worst case scenario. He tore the popliteal artery, the artery that brings blood to the entire knee and the lower leg. And what happens, you tear that, it's not going to get blood flow to the lower leg, and in a short period of time, that person's going to lose their leg and need amputation.
Short period of time is what?
Is a period of hours.
Really?
So within a couple of hours, you lose that blood flow to the lower leg, and you can lose the leg. So they were not embellishing that story at all.
I'm sorry to interrupt you, but is that artery then right underneath, inside the knee, going down?
It's right through the middle of the knee. Right through the middle of the knee. And it's really at risk when the whole knee dislocates and shifts. We see nerve damage too. So this is an injury that, again, we kind of use pro football to kind of bring up, but it happens in kids in college, is the Jalen Smith injury, the guy at Notre Dame a couple years ago. He got the nerve damage part of it. He had a drop foot for 9 to 12 months. He didn't get back playing with the Cowboys for 15 or 16 months after his knee dislocation, but his was nerve damage. I'm told that he still has a little foot drop. Teddy Bridgewater, dislocated knee. Willis McGahee, way back when in the championship, dislocated knee. This young man dislocated the knee and tore the blood flow, the artery, the popliteal artery. And that's why don't take any chances. If you see this, the medical teams are watching the field closely. You say, hey, what are they watching for? There's nothing. You might go 100 plays, 200 plays, and then you see something like this. And when you see that knee dislocate, not a kneecap dislocation, the whole knee dislocates. If you saw it and saw the replay of it, you knew that was a very abnormal dislocation of the knee. That person needs to get the squad here now, get that person to a place. In New Orleans, they had a vascular surgeon on call there who actually did a graft. That means put in a new fix and put in a new artery.
And this has to be done in hours, right?
This has to be done in hours. And they, from what I'm told, even as of this morning, good blood flow, good pulses, but he's still not out of the woods. There can be blood clots and other things with the graft, the new artery they put in. They put in a new artery, a graft for this guy. And from what I'm told so far, it looks like he's going to save the lower leg.
Okay, saving the lower leg, but is his career done? That's the follow-up. What's the recovery for this?
Yeah.
Is it just like the whole dislocated? You see a lot of guys' careers in the sports arena be gone after this.
You do. And McGahee tried to come back and didn't very well.
Marcus
Jalen
Latimer,
Smith
I think of, with South
Latimer
Carolina.
was from South Carolina, never really got back. But this one with an artery torn, I would think they'd be very unlikely to get him back. But a lot of those did not. They had nerve damage. Most of the time, many of them try to get back. But in this one with an artery, I'd say probably career-ending.
With the artery damage, can you have both the artery and the nerve damage in a situation?
You can have both. Yes, you can have both. torn in this very significant. So it's just one of those. There's a lot of things that you have plenty of time to sort through. Is it a ACL tear, a kneecap dislocation, or other things? This is one you don't have a lot of time. This is one of the few real musculoskeletal emergencies, to a joint or muscle tendon. This is one you got to get them to the emergency room and get them to a center that has the services of a vascular surgeon to do a graft if needed in a case like this.
One other thing I wanted to bring up over the weekend, there were a whole slew of NFL football injuries. And I heard MCL tears, and then I heard a couple of times MCL sprain. What's an MCL sprain? Is that just the thing being stretched and it's in a bad shape? Obviously, we know what a tear is.
No, sprain.
But what about a sprain?
Sprain, Ray, runs the whole spectrum. So sprain goes from grade 1, where it's a stretch injury, to a grade 2, which is a partial tear, to a grade 3, which is a complete tear. We've had a lot of those around our area this fall. I think we always do in football, but a real lot down at our place this year. And in a few of those that we knew were bad, you have to get an MRI. Some of those, although most people hear over and over, MCLs can be treated with bracing and rest and rehab and do well. Some of the really bad grade 3s don't do well, and they need the discussion and sometimes actually even surgery to fix even a really bad MCL. So we'll sometimes, if we're really concerned about those, we'll even get an MRI to help us. Most of the time, though, with our hands, that's a diagnosis we can make on clinical exam pretty well. The difference between a grade 1, a grade 2, and a grade 3. Grade 2s are usually back in about 4 to 6 weeks, so that's a very common high school football injury. Grade 1s might play in a week if it's just badly stretched and stuff. So it's a sprain. Those are the 3 grades of sprain. 2 is a partial tear, 3 is a tear. That's kind of the terminology we use.
Good stuff. Joe, thanks for coming in. Great information.
Thanks, Ray. Have a great week.
You too. Dr. Joe Congeni, Sports Medicine Center, Akron Children's Hospital.